My name's Grant Stewart. I'm a university lecturer in surgery at the University of Cambridge, and I am a urological surgeon looking after patients with kidney cancer, and all of my research is undertaken into that disease. One of the areas of research that I'm most interested in kidney cancer has actually come about because of discussions with lots of patients who've had the disease. And that is why we are not able to pick up kidney cancer much earlier on, and therefore at a stage at which it would be curable by surgery. Most kidney cancers that occur when they are so-called small renal masses are picked up by chance, by a scan that's done for another reason, not related to the lump that's in the kidney. Whereas later stage disease is usually found because of blood in the urine or pain in the side where the lump in the kidney is found. So we have developed this concept of whether screening the population for kidney cancer is worthwhile. Now, clearly there are already screening systems that take place for a range of other diseases: breast cancer, colon cancer, aortic aneurysms in the abdomen. And there is controversy around some of those screening programs, around the possibility of diagnosing conditions that never need any treatment, as well as the cost of that screening program. So in order to make sure that we do set up a research program in a sensible manner, we're taking this one step at a time. One of the really important missing pieces of information is who should actually be screened for kidney cancer. Ideally, we would say that everyone above a certain age would be screened, but for example, in some diseases such as abdominal aortic aneurysms, only men are screened, and that occurs once at the age of 65. So in kidney cancer, we want to establish whether both males and females, and what age group screening should be undertaken at. Should it be at the age of 55 or 60 or 65? Equally, we don't yet know whether we should undertake a single screening investigation at one age point, or whether in fact we should repeat it every 5 years. Clearly there's likely to be more discovery of more people with kidney cancer, but equally there will be extra cost associated with this. Now, the cost effectiveness analysis that myself and Sabrina Rossi have undertaken is going to help unpick some of these points and also address where we need further evidence to evaluate this. So the next steps for us in this piece of work that's going to take several years to complete are developing the next pieces of information leading up to a randomized controlled trial for screening for kidney cancer. So the next step is going to be the Kidney Cancer UK initial funding for us, which will be a feasibility study as to whether ultrasound technicians can in fact find the kidney and find kidney masses, and therefore provide the diagnostic tool that's required to undertake screening. And then we hope to continue with a positive result from that trial into a pilot study of screening, and then into a full randomised study. And we're very grateful for Kidney Cancer UK's continuing support with this work. So you may be wondering why we can't simply introduce a programme of screening for kidney cancer, just inviting people for a scan to determine whether or not they have the disease. Well, there are a number of reasons why that isn't possible currently. Firstly, kidney cancer is a relatively rare cancer, and we don't understand exactly how common it is in the wider population. So the piece of research that needs to be done around that. We also don't really understand the best way to screen people for kidney cancer. Ideally, we would undertake that using a relatively cheap scanning technique, and one that doesn't have any side effects. So ideally that would be an ultrasound scan, a jelly scan. But can we train the technicians that would be needed to do that scan, to find the kidney and find a mass within the kidney? we don't yet understand that, and again, that's another piece of research that's required. Finally, we don't yet know the cost effectiveness as to whether or not there really is a strong rationale for screening for kidney cancer. Yes, we know that the drugs that are given in late stage kidney cancer are very expensive when compared against surgery, which is curative, but equally we don't yet have the figures for a screening program versus the current diagnostic pathway that we have. So thank you very much for your donations to Kidney Cancer UK. I hope you can see that they are being used for a research program that would otherwise be difficult to fund, but which we hope in the long term will benefit people who have undiagnosed kidney cancer, identifying that disease early and providing more people with cure from this lethal condition. So thank you once again for all of your support.